Hey everyone, my name is Andrea and my drug was tobacco, so I'm going to tell you a little bit about that. Um, for those of you who don't know, tobacco is the leading cause of preventable illnesses and death in the United States. Um, there are actually more deaths associated with tobacco than HIV, illegal drug use, murders, alcohol use, and suicide combined every year. And that's crazy. I think that says a lot about how serious tobacco use really is. Some personal factors that are affecting or that may impact tobacco use are self-image and low self-esteem. If an individual is feeling kind of bad about themselves, or like they maybe aren't as important or something as their friends, or even just like compared to other people, it could impact their use of tobacco. Genetics plays a role, so if your parents or a family member of some sort was addicted to tobacco, it could kind of impact it as well. Traumas such as neglect, sexual, physical, or verbal abuse, altercations, or accidents play a role in it. Personality disorders, academic stress or poor academic performance, kind of having the stress that they aren't exceeding the way that they wanted to. And ADHD, PTSD, or depression play a role in personal factors that impact tobacco use. When it comes to societal factors, the environment you live in plays a role in it. So if you're a individual with divorced parents, or if you're living in a household where your parents are constantly fighting or arguing, that has an impact. Peer pressure plays a role with like deviant peers. If they're doing something, you want to do it to fit in. School, work, or home stress, kind of just using tobacco as a coping mechanism. And popularity or bullying, so if you are getting bullied and you think that tobacco will kind of help you cope, you will try it. There are currently 40 million Americans that smoke some sort of tobacco product. And tobacco has a lot of biological impacts that I don't necessarily think people really consider. So I'm going to go through some of the biological impacts of tobacco use as well. Your circulation can actually be impacted with tobacco use. So tobacco has tar, and there's poisons within those tars, so it increases blood pressure and heart rate, so it makes your heart work faster. It makes your blood thicker, which increases your risk of clots, and it narrows the arteries, reducing oxygen-rich blood to the organs. The heart is obviously affected. It increases your risk of coronary disease, heart attack, stroke, vascular disease, and cerebrovascular disease. Carbon monoxide makes heart work faster and increases risk of blood clots and damages the coronary arteries and makes you 2 times at risk of heart attacks. As for your stomach, increased risk of stomach cancer and ulcers. It weakens the muscles in the stomach, which causes acid to travel in the wrong direction. The bones are affected by tobacco use, so nicotine causes bones to become brittle and weak, and women are at greater risk of osteoporosis if they use tobacco products. Obviously, the brain is impacted. It increases risk of stroke, increases risk of developing brain aneurysms, and the lungs are affected because it causes coughs, colds, wheezing, asthma as a start, but it can also lead to fatal diseases such as pneumonia, emphysema, and lung cancer. Chronic obstructive pulmonary disease means there's difficulty breathing, coughing with phlegm, or frequent chest infections. And the last 2 are mouth and throat, which basically mean you'll have bad breath, stained teeth, gum disease, damage to the taste buds, increased risk of cancer of the lips, tongue, throat, voice box, or esophagus. And what one people don't know is that it can affect reproduction and fertility. So it can cause male impotence, which damages the blood vessels to the male genitals, and it damages sperm and reduces count, and it causes testicular cancer in some cases. As for women, it can cause infertility. It increases the risk of cervical cancer, has the potential to cause miscarriages, premature births, and stillbirths. Thinking about prevention and treatment as well as harm reduction, prevention is basically just well-designed, well-implemented school programs to prevent tobacco use and addiction. So those are basically evidence-based interventions. This provides education to those who are at greatest risk of developing an addiction, and it establishes that non-use of tobacco is normal and leaves room for positive role modeling, so like teachers or parents who don't smoke. And it prevents the use of other drugs, because if you try one, you're kind of more likely to try another. It can inform of the short and long-term consequences of use. And one thing that the policy level measure could be is to increase taxes for tobacco products, which enforce how and where products can be purchased, as well as where and when they can use them. But when it comes to treatment, behavioral therapies are a big one, as well as such things as nicotine gum, spray, inhaler, which gives low doses of nicotine without using tobacco to kind of wean them off of it. Bupropion and varenicline are two medications that can be used to help quit. But then there's also cognitive behavioral therapy, neuro-linguistic programming, and there's a lot of benefits that come from like when you stop smoking, like if you quit smoking for 5 years, your risk of stroke is the same as somebody who has never smoked in their lifetime, which is a big deal. And finally, when it comes to harm reduction, there's a tobacco harm reduction specifically, and the strategy is used to help lower health risks that go with the use of nicotine. So the goal of tobacco harm reduction is to minimize and eventually eliminate the use of combustible tobacco altogether. So this includes smokeless tobacco products, electronic cigarettes, or even nicotine replacement therapies. And providing these harm reduction options has a chance to lower the total population risk than strictly abstinence-only policies.